kidney disease often hides in silence, but knowing the crucial information you'll discover here could literally change your life. So stay tuned all the way to the end because every detail might matter if your body is trying to warn you. When your kidneys start to struggle, your skin often becomes the first messenger, showing symptoms that may seem minor but are in fact revealing serious dysfunction in these essential organs. The very first change you might notice is extreme dryness of your skin. This is not regular dryness. It transforms your skin into a rough, flaky surface, sometimes even resembling fish scales. This condition affects up to 75% of people who are on dialysis and occurs because your failing kidneys can no longer balance your body fluids properly to keep your skin healthy. Your skin may get so dry that it cracks, creating painful splits that sometimes bleed. To help counter this dryness, use a gentle, fragrance-free moisturizer daily, ideally right after bathing. Avoid hot showers, since they worsen dryness significantly. If you notice any of these symptoms, make sure you subscribe to this channel. It's free, and it really empowers our community to keep sharing such life-saving information. So hit that bell too, and tell me in the comments where you're watching from. The second red flag is intense itchiness, which can affect your whole body or be limited to certain spots. This itchiness, also called uremic pruritus by professionals, impacts around half of all people with serious kidney issues, and nearly everyone on dialysis. The severity can range from mild discomfort to an unbearable sensation that disrupts your sleep and daily life. Itchy skin is triggered by an excess buildup of toxins in your blood, which your kidneys can't filter out properly any longer. High levels of phosphorus in your bloodstream, a direct result of kidney failure, further enhance this non-stop itch. For relief, apply cold compresses to the affected areas or lotions containing oatmeal, which is naturally soothing. Keep your nails short and neat to avoid hurting yourself while scratching. Try gently patting instead of scratching if you can. See your doctor for antihistamine medication if the itching gets out of control. If you're scratching all the time, your skin experiences visible damage with distinctive warning signs. You will likely notice red, raw, or bleeding patches wherever you scratch. Some patches of your skin may become thick and leathery, a condition doctors call lichen simplex chronicus. You may get persistent small, itchy bumps forming what doctors call prurigo nodules. These skin lesions are not just uncomfortable, they seriously increase your risk of secondary infections. Another clear indicator is skin color changes that happen when kidney function drops. The buildup of toxins in your body causes distinct color shifts. You might develop a pale, tired-looking skin tone. A grayish color can also set in, especially on the face and hands, giving your skin an ashen appearance. Sometimes you get a yellowish tint due to an accumulation of urochromes, pigments your kidneys can no longer filter out. Uneven dark spots might show up all over your body. Thickened, yellowish skin with deep lines and small whitehead-like spots may appear, especially where you scratch most. You could notice cysts and white bumps on the skin too. Keep in mind, these skin color changes can also occur in other diseases, so always speak to a health professional for a precise diagnosis. Kidney disease does not just affect your skin, it impacts your nails as well, providing important clues about your health. Watch for nails that are half white on top and reddish-brown at the bottom, sometimes known as Lindsay's nails. This sign shows up in about 20 to 50% of patients with kidney failure and is more frequent on toenails than fingernails. Look for white lines or transversal bands across the nails, another sign of overloaded toxins in your bloodstream. Your kidney's inability to get rid of waste like urea and creatinine is what causes these nail changes. Nails may also turn yellow from metabolic waste products. You might find your nails grow brittle, start lifting away from the nail bed or spoon downwards. To protect your nails, avoid trauma by keeping them short and clean. Keep them away from harsh chemicals like acetone. The single best way to reduce these nail warning signs is to improve your overall kidney health. The fifth major sign is fluid retention, noticeable by swelling in different parts of your body. Your kidneys help remove excess salt and water from your body. As kidney function declines, fluid builds up in your tissues, leading to characteristic swelling. You'll probably notice this in your legs, ankles, feet, hands, or even your face. This swelling is often worst in the morning or at the end of the day. Fluid can also accumulate in your lungs, which will make you short of breath when exerting yourself or lying flat. Abdominal swelling, or ascites, can happen due to fluid buildup in your belly cavity. All this retained water can cause you to gain weight quickly for no obvious reason. To control swelling, try to cut back on salty foods, which make fluid retention worse. Prop up your legs when sitting to improve lymph drainage. If your health professional advises, wear compression socks. Always follow your doctor's guidelines on restricting your intake of liquids and salt. In the more advanced stages of kidney disease, you may develop small, itchy bumps that are another serious skin warning sign. They usually start off alone but quickly join together, forming rough, raised patches. These rashes arise directly from toxic waste building up in your bloodstream. Bumps tend to be itchy, often creating significant discomfort. They usually show up on the arms, legs, and sometimes your torso. To soothe these rashes, use any medicated creams prescribed by your doctor or apply gentle moisturizers. Stay away from soap with harsh ingredients as these make irritation worse. Keep your skin cool and avoid too much heat, which intensifies itching. Wear soft cotton clothing so your skin can breathe. Some people with end-stage kidney disease may develop painful blisters in random body areas. Often these show up on the hands, face, or feet because the toxin buildup is very severe at that point. Inflamed blood vessels, known as vasculitis, may also help form these blistered lesions. These blisters can be extra painful and are at a high risk of infection if not treated properly. Never try to pop, squeeze, or remove them yourself, as this increases risks of complications. Speak to your doctor immediately for correct medical care. Another danger sign is discovering a lump or swelling on the side of your belly or lower back, which could indicate kidney cancer. Usually it's not painful at first, so this is all the more reason to check for it regularly and report anything new. Always have any new lump checked by a health professional. Kidney cancer may also be accompanied by blood in your urine, ongoing tiredness, or rapid unexplained weight loss. Catching it early is crucial for better treatment and recovery odds. Some people with very advanced kidney disease will notice deposits of calcium forming under their skin, which is known as calciphylaxis. These usually develop near joints or on fingertips, and the pain can be extreme. If they break the skin, they might leak a chalky fluid. This sometimes pops up alongside the half-white, half-brown nails mentioned before. Calciphylaxis is a very serious condition needing urgent medical help. Never try to squeeze or remove these by yourself. They require specialist care and close monitoring. This condition comes from mineral imbalances caused by kidney failure, especially high blood phosphorus and calcium. Now that you are aware of all these signals, you may be asking yourself what to do if you spot them. Remember, not every skin change means you have kidney failure, but if you already know you have kidney issues and you're seeing these signs, never ignore them. First, get in touch with your nephrologist or family doctor to see where your kidney health stands. A visit to the dermatologist can also help, especially for dealing with the skin symptoms directly. There are effective treatments to relieve most of these skin problems. Special moisturizers can really help with dry, cracked skin. Medical antihistamines could provide relief from intense itchiness. Targeted skin treatments can be prescribed for the specific types of rashes or bumps. Managing your underlying kidney disease is the key to improving all these symptoms. Carefully control your diet, especially salt and phosphate, to keep swelling and itching down. Follow your prescribed medicines exactly to slow kidney trouble. Hydrate properly as advised by your physician. Never assume more water is always better. Take part in light physical activity with your doctor's guidance to boost both skin and kidney health. Keep track of your blood work numbers and share them with your healthcare team. Maintaining correct skin hygiene is super important when you have kidney issues. Use only gentle, fragrance-free soaps. Avoid irritants that can worsen symptoms. Apply moisturizer right after showers or baths to lock in as much hydration as possible. Avoid extreme heat or cold, because both can wreak havoc on already compromised skin. Comfortable, loose cotton clothes. Allow your skin to breathe and help prevent irritation. Keep the humidity level in your living space up if the air is dry, to stop skin from getting worse. Regular monitoring and rapid action are vital for keeping these symptoms under control. Take photos of skin changes so you can show your doctor how things progress. Keep a diary of your skin's condition and triggers that may make symptoms flare up. Record exactly which remedies help and which don't. Watch for new symptoms or worsening of old ones. Check in promptly with your healthcare team whenever something changes for the worse. Prevention is your biggest ally in stopping serious skin issues before they start. Use sunscreen to protect skin, as those with kidney disease are extra sensitive. Do everything you can to prevent injuries, since wounds can become infected much more easily. Keep a healthy body weight, which reduces pressure on your kidneys and skin. Monitor your blood pressure and control your blood sugar if you have diabetes. Never take medications that hurt your kidneys unless your doctor says it's essential. Maintain a balanced diet designed for kidney function. Stay as active as possible. Every little bit helps your circulation and well-being. Don't overlook psychological support, because living with visible skin and nail changes can be tough emotionally. They might affect your confidence and quality of life. Don't hesitate to seek out kidney patient support groups and connect with others. Talk about your worries with family and friends for understanding and backup. If you're experiencing anxiety or depression about these issues, consider professional counseling. Stick with your favorite activities as much as you can to protect your mental well-being. Remember, these skin symptoms, though uncomfortable and even distressing, can all be effectively managed if you take the right action and stay consistent with your care.